Um, how are you, doctor, and everyone watching my video? I'm Caroline Lusinje, first year student doing Masters of Computer Science, Data Science, and Artificial Intelligence option. So I'm going to be doing a quick review on the congenital heart disease detection by pediatric electrocardiogram-based deep learning integrated with human concepts. Congenital heart disease, it is one of the most common birth defects, and which mostly causes mortality in children. This is a condition whereby children's heart it becomes sick, and you find it has like a valve, a hole, or many other defects. And we believe that early and accurate identification of affected patient can be so crucial can be so crucial for effective so we have the steps involved in creating any AI enabled congenitive heart detection model with electrocardiograph data. So we have data collection. This is gathering the data, cleaning it, normalizing the signals. Feature extraction. Here you are trying to extract some relevant features, including depending on your domain and the implementation. In data argumentation, that's optional, but it's like transforming data, scaling, normalizing, kind of sort. Then model selection, this is more like choosing the model. You can have a convolutional neural network model, revolutional, or hybrid. And we have the model design and training. Here is where you split the data, validate, test and train the model, as well as like fine tuning to boost the performance of the model by tuning the. We have model evaluation. It's more like evaluating it for accuracy, precision, or recall using different matrices. We have model interpretation, that's analyzing the model, like how is the model performing, how is it interpreting things. Deployment and integration, it is deploying it in an environment that it is suitable for it. For example, a CHD model, you can integrate it with some various systems, or you can have it as a standalone application. And we have a continuous monitoring and improvement. That is like you keep on retraining, fine-tuning, and you make sure the model is performing as expected. Then, as a data scientist, of course, and an artificial intelligence engineer, you have to make sure that you keep privacy as key, transparency, and collaboration with medical professionals for validation and clinical review. So we have a quick overview. The ECG data or deep learning neural network. Like you can see, this X1, X2, X3 up to Xn. These are the inputs. That is called an input layer. We have hidden layers. Those can be as many as expected, depending on what the model is supposed to do and how you are doing the implementation. Then we have the output layer that is reduced from the hidden layers. That's the real output, like the performance of them. And we have an overview of the convolutional neural networks, for example, as one of the AI models I have chosen. In deep learning, these are actually effective for image-based tasks. Even in ECG analysis, their input data is represented as a 2D image. Then they consist of layers, like I told you. which we have the input layer and many other layers. So as this network learns from labeled ECG data, those are the inputs, they have to be labeled, the supervised kind. It adjusts the weights of these filters to recognize patterns associated with the normal and abnormal heart conditions. So we have the output layer, which consists of neurons that represent different heart conditions, like the diagnosis. And we have got challenges by some traditional methods. For example, commonly used examination methods like transthoracic echocardiography, X-ray, cardiac magnetic, and those imaging methods are really complex and time-consuming. Like they're not real-time based, and they're heavily dependent on the evaluation of experienced cardiologists. Like you really need an experienced cardiologist to operate or to perform those methods, and that leads into the delayed diagnosis, which results into suboptimal clinical intervention in low and middle income regions especially. So we have a study that was carried out which demonstrated that there is a delay of 85.1% rate as far as using those methods are concerned. So that's how we came up with an end-to-end deep neural network-based approach for pediatric ECG cases. A deep neural network-based approach, that's, for example, in this case, we are using a congenital heart disease diagnosis via an electrocardiogram. So this came as a result. Early detection is critical in achieving in efficient treatment. So developing such effective techniques is really cost effective, and they're actually highly desirable. Recent advances in deep learning, artificial intelligence have demonstrated the cardiologist level, and they're reliable in terms of performance compared to the traditional methods, and no expertise. As long as the model is ready, anyone can implement it. And we have advantages of such models. One of the major advantages, we have the earlier investigations. Yeah, since these models can derive benefits not only from automatically extracted features of ECG waveform data, but also from the conceptual features utilized by human experts and features obtained through wavelet transformation. Those are our inputs there. So if we are a review and a workflow of neural-based deep learning model, we have a quick review. This model extracts features from pediatric electrocardiogram and wavelet transformation techniques, and then integrates them with the key human features in order to make direct probabilistic predictions for congenitive heart detection. Yeah, first and foremost, potential or pediatric patients had to undergo, this is a review, severe examination consisting of echocardiography, electrocardiogram, in accordance with what the European Society. So the doctors helped in analyzing the examination result. Then the next phase was the CHD was used only pediatric ECG data to identify CHD cases by integrating features automatically extracted from ECG wave data and wavelet features with human features. Yeah, so we have those cases that we are using for young children of whose age was between 2.12 to 1.5, since they are mainly key actors that are being affected by this layer at the input level. This is an input. Then the hidden layer, here we have a lot of things happening. For example, this is where we start developing our model, building our models, extracting features, blah, blah. Then we have the output. How is the model performing? Is it doing well? Is it doing badly? For example, we use the metrics like true, positive rate, and precision to metricize our model or to evaluate our model, and this other. So what happens actually in a neural network? We have, like I told you, we have three layers: the input, hidden, and the output layer. The input layer, here we have the human features, human concept features computed with some rules. Then again, they are converted into the wavelet coefficient energy characteristics, like we saw in the other picture. Then we have the hidden layer, then whereby these features of these types are fed into a proposed AI model for automatic fusion and CHD detection. Output layer, this is actually where we have our model being, like our model performing, yeah, like it is trying to come up with a diagnosis compared to what the cardiologists did, the cardiologists implemented. So after that, we continue with the results of the output layer. After the training, of course, we have the results from the output layer. I'm trying to expand it. We evaluated the performance of the trained model on the internal test set and two external sets. Both the specificity and sensitivity of CHD detection exceeded 0.8, that's like 80. So like we can see, the performance was really high on the two, and we had specificity values of 0.93, only 93, and 0.90 respectively, with the scores that approached 0.8. That is a very, very high score, meaning that their model actually was doing well. Yes, and there are many indicators here, so that show the performance and robustness of what? Of congenitive heart disease detection. So still various matrices like area under curve were also considered, which yielded very high results. Like you can see a 0.91 and a 0.907 for both internal test and external test. In conclusion, I can say heart disease, actually, it has been a widespread issue across areas of varying income levels, which has led to missed opportunities for timely interventions, and meaning us getting the such robust models, it really helps much in making sure that we come up with efficient disease detection, hence efficient. Yeah, these are my references. Thank you very much, and thank you so much.